Good morning. Such a pleasure to be amongst you. So let me begin by saying that I do believe, and over the last 40 years of my career, I have seen that the sky can be pink. You can dispel myths, you can reprove theories, you can change the way people think about things if you have the courage and the conviction to change the way the world is. And that is the beautiful metaphor of my sky is pink. Did any of your parents teach you what color the sky was? Did any of your teachers ever tell you that the sky was pink? Technically, no, but metaphorically, yes. And that's what we're here to talk about today. So rather than give you theories of how Galileo, Edison, the new Nobel Prize winners who proved this through physics and were actually collaborating with the University of California, San Diego, where two of those inventors actually studied. So many of the people who have brought forth new theories had the courage and the conviction to stand up for what they felt was different. And my story, or the story of Apollo, is very similar. So let me begin once again by saying, don't let anybody tell you what color the sky, your sky is. The world's sky or the earth may be physically blue, sometimes orange, but you've seen it in shades of pink. But the real power and the conviction is to say that I can make a difference. And I see the world in a different way. I see a world where nobody has to die of cancer. I see a world where public transportation is so effective that we're not polluting the environment. I see a world where no child goes to bed hungry. I see a world where the current statistic of stunting, you know that 35% of children in India do not have adequate nutrition and therefore come under the clinical definition of stunting, that is poor growth. All these are current statistics and realities. But you can dispel these kind of realities by seeing and dreaming of a new world. So our story, or the story of Apollo, was really somebody who saw a different world. When Dr. Reddy came back to India, and he came back because his father told him that he was a very successful doctor abroad, and his father sent him a letter saying, every time you write to me about your success, two people are happy, which is your mother and I. But if you came back and practiced in India, imagine how many people could be happy. Simple line. He didn't tell him to come back. He said, imagine. And that is what I'm requesting all of you to do, imagine. So Dr. Reddy came back, bringing with him 4 daughters who were too young to protest, who didn't realize that in the India of those days in 1970, there would be no pizza and hamburgers, there was no McDonald's, schools would be very different and life would be a little tough, but we were too young to realize that. But the larger picture of change the healthcare. So he set up a clinic, he began to practice, he was doing wonderfully well, and all his patients he would send to America for heart surgery. Because in those days, India did not have credible heart surgery. So what he then, one day he lost a young man who left behind 2 small children. And when he saw that, he said, I have to build something in India. We have to create something which is completely different. And that was how the concept of Apollo was born. In those days, hospitals of that nature were not in the private sector. Private hospitals did not do bypass surgery. They did not have the results, they did not have professional management. But he had the courage to reimagine, to rethink what the world could look like. And that's how we started Apollo in 1983. Today, 16 large hospitals, 73 hospitals overall, over 12,000 beds, 350 clinics, 6,500 pharmacies, 2 medical schools, 16 schools of nursing, and many, many, many more. But most important, the single purpose for which we began, which is bring healthcare within the reach of people, that purpose remains the same. And reimagine what is not happening in the world today, reimagine and bring better care to people. So let me go on to share this story a little bit. Another area where we change the color of the sky. I don't know if all of you know, and I'm happy to see so many accomplished young women in this room, but about 40 years or 50 years ago, 60 years definitely, a family was not considered complete unless they had a son. And Dr. Reddy had 4 daughters, me and my 3 sisters. And people would say, poor Dr. Reddy, he has 4 daughters. And my sisters and I, when we grew up, we began to work, we were committed to change that thought process, that having a daughter is a powerful, wonderful thing. And today people say, lucky Dr. Reddy, he has 4 daughters. So that is my pink sky. That is how we reimagine what can happen. And so to every young woman in this room and to every young man, please, it's not about women being capable or superior. It's about the world being equal and everybody having a role to play. Because in our new vision of the world, everyone can contribute. And it's not just the gender. It's not just about the socio-economic status. It's not even about, there's LGBT, there are different biases, but a handicapped person, a physically challenged, everybody has a role to contribute. And our ability to appreciate that the world has so much to give if we can unlock it, or there is so much we can create if we create a more equal world. That is the power, that is the beauty, and maybe that is your pink sky. So moving on, I wanted to come to you to another subject which I believe is transformational. You remember at the beginning I spoke about the fact that maybe we can dream of a world without cancer. Let me tell you that there are 3 B's which are transforming the world. The first is biology. When Watson and Crick deciphered the DNA, that was the beginning of biology becoming center stage of healthcare. It is because of this DNA that we know why somebody gets a heart attack even though they live a healthy lifestyle, and somebody else who doesn't have such a healthy lifestyle lives to be 102. These are facts, this is data. But new data is also emerging, and now we know that it's not just genetics, it's epigenetics. So science is playing a defining role in reinventing. But besides the B of biology, another big one is bytes. The computational capacity of the entire world. Our computers are coming in and giving us and sharing data. Those computers are sitting inside the imaging of CT scans. And what began as a 64-slice CT became a 160 slice, a 320 slice, a 640 slice. This computational capacity is giving us better images, telling us where is the tumor, how is the blood vessel closing, and this is giving insights into care and cure and to heal people. And the third byte, the third B is actually bandwidth. Because of bandwidth, we are able to take the knowledge of care or the knowledge of connectivity and bring that to rural India, and that is telemedicine. So these are the 3 B's which are changing the way we are looking at healthcare. And as you probably know, we have already done a robotic surgery with that one doctor sitting in Gurgaon, and then the patient was in Chennai. And this is because of bandwidth, that you can move the hands of the robot, controlled by a human, and use bandwidth to connect it. Imagine taking that same thing and bringing high-end surgery into rural India. Imagine that we as Indians can say we can help to heal the world, so we will operate out of India, the patient may be in Africa. There are so many beautiful possibilities when we dare to dream, when we put humanity at the center of our dreams. But sharing that thought process a little more, I just want to say one more thing on healthcare, and that is we have a proud heritage. We began with Sushruta, whose methodologies and science actually knew so much more. When Dr. Denton Cooley, the doyen of healthcare, visited us in India, my father gifted him a Ganesha. Do you know why? Not just because Ganesha is a god that all of us love, but he said Indians were doing transplant, not just organ transplant, but multi-species transplant even before anyone else in the world. Today, we have the hearts of pigs being used to transplant into human beings who do not have a heart which is functioning. And recently in Boston, I saw the scaffolding or the structure of a heart embedded with the stem cell of the same individual, and they regrew the heart and then did the transplant. So that is the future of what all of you are going to see. And this is what we can make happen in our country at affordable prices. So remember Sushruta, remember the transformation. Remember that 25% of clinicians in the United States, which has some of the most advanced care, are people of Indian origin. And with that pride, go forward, saying that we can help to heal the world. Moving ahead, our Pink Sky is also about bringing advanced diagnostics, bringing proton therapy, which does cancer care, for the first time, not just to India, but the first time in Asia, so that we can help bring better diagnostics. Using robotics so that the precision of surgery becomes better, and precision medicine using data and robotics and DNA analysis and CRISPR therapy. All these are going to completely transform the healthcare, and those are my blue sky. Those are the dreams that we can find a way, at no point of time should a doctor have to say, this patient is inoperable. And even better, patients who have 3 vessels and 4 vessels blocked, 20 years before, their first vessel was getting blocked. With new age diagnostics, with a simple blood test, or even a wearable device or a ring, maybe we can find out when that first vessel is getting blocked. Change their medication, change their lifestyle, and prevent the block. I have challenged my orthopedic surgeons that in 20 years, nobody will need to have a knee transplant. Do you know that they remove the knee joint and put a metallic joint? Imagine if we never have to do that. Because in the very beginning, we put stem cell and regrow the cartilage. Because the cartilage wears out, the bone wears out. Because the bone wears out, you need a new joint. Imagine if we don't have to do that. These are the possibilities. This is my Pink Sky. And more of things that we have already proved. This is telemedicine in CASA, one of the highest points where we have a connectivity to our emergency room, and therefore using devices, we're able to see the patient, see his heart rate, understand his echocardiogram, and tell the nurse on the ground, there is no doctor in that place, tell the nurse on the ground how to give life-saving therapy, and then message to a helicopter to pick up this patient, because 6 months of the year, even a car can't go into that area, you need to fly in. These are the kind of things that we could do 2,500 kilometers away from any place, any accessibility. You can still save a life. Remember the third P, bandwidth. Moving on, I think that all this in terms of the connectivity, the capability was another instance of reimagining reality, which happened in my life. In the year 2000, my father was putting up a hospital in his village. It's a remote village, outskirts of Chittoor. And then when we put this 100-bed hospital, you can build the building, you can buy the equipment, but how do you get doctors to go and live in these areas? And that was the first time we imagined telemedicine. Today there are thousands of connections. You can pick up your phone and talk to your doctor. You can teleconsult with a doctor anywhere in the world. But when it first began in 2000, nobody believed it could happen. And those days we didn't have the connectivity. There was no 3G, no 4G, no 5G. We put 3 phone lines together, created enough bandwidth so that we could transmit an image. So a radiologist sitting in Hyderabad could interpret what is happening in a small village in Chittoor. And then in the year 2000, Bill Clinton was visiting India, and Chandrababu Naidu called and told my father, showcase something that your hospital is doing. So he said, okay, we'll show Aragonda. 4 days before the program, I said, imagine in front of the President of America, one of the most powerful people in the world, the Chief Minister of our state, and my father, most powerful in my book. So in front of all of them, if these 3 phone lines fail, what am I going to do? So just 4 days before, I went to Bangalore to ISRO. We got 2 satellites, mini satellites, connected them point to point with perfect connectivity, and the day went beautifully. We ran on the ISRO satellites for 4 years, but then telemedicine was point to point. Then we started getting internet connectivity, so it became one doctor to many. And finally, it's become many to many because of the connectivity. So the world is changing at this tremendous pace. How can we use these developments? How can we use connectivity, transmission capability? The word Elon Musk says he's putting a balloon in every point in the sky. So even if you're in the jungles in the Amazon, you will be able to connect. How can you use this to help humanity? That is really how you find your pink sky. So if we think that no problem is impossible, that we can achieve everything, then many, many of these dreams can come true. And the future is really, like I said in the beginning, where no case is inoperable. Most cases can be prevented because of what we've done with a different portion of science. And the concept of health starts really from the time a child is in the womb. The concept of health lives through all of you, through your healthy living, through your ability to understand what really creates the parameters of a perfect world. But moving on, I think pro-health, this proactive preventive healthcare, using smartwatches, using sensors, using devices. Today, if somebody is not well, you'll check their temperature, you'll check their ECG, you'll check their blood pressure. Tomorrow, it will not be the symptoms that you check, but the signals that your body is giving. Your watch will be monitoring your signals, your temporal capacity, your gut and your microbiome, all these are giving out signals. This diagnostics will interpret that, and all of you will reimagine healthcare, or those of you who commit yourself to healthcare. That is the future, that is my pink sky. But when you find, many of you may be thinking, okay, she's 60 years old, she's talking about her pink sky. How do you find your pink sky? And so this is a simple framework which is actually, kind of taken from one of my favorite books of Jim Collins, which says from good, and all of you are great. All of you are good, but how many of you will become great? So please look at that book, Jim Collins, From Good to Great. I believe many, many of you are already great and can become even greater. So look at, what does the world need? Is it science? Is it mobility? Is it environment protection? Is it peace? Is it mental health? Is it humanity? Is it kindness? Figure out what the world needs. And then, what are you best at? What makes you happy? How do you do it? What is your skill? What are you best at? And finally, what is your passion? What makes you wake up in the morning and say, I love it, it's not work, it's my passion. That is why my father at 92, he's 92 years old, he still wakes up every morning, puts on his suit and goes to office. He does rounds in the hospital to see patients because he's passionate about it. So what does the world need? What is your skill? And beyond your skill, what are you passionate about? What makes you happy? At the intersection of these 3 circles is your magic. Discover your magic. Don't Let everybody else you can learn from, you can be influenced a bit, but the final decision you should arrive at with a lot of your own input, your own thought. Maybe your grandmother told you to become a doctor, maybe your uncle said an engineer is great, look at Satya Nadella. But find what you like. Maybe you want to be Mother Teresa. So figure out what is your pink sky, and don't think you're too young to start thinking about it now. This is the perfect time. You are the empowered youth of tomorrow. You are the transformational adults of the very next era. And therefore, the world is looking to all of you. So I'm very, very happy to be sharing this framework. Please find your pink sky, the intersection of what the world needs, what are you good at, and what are you passionate about. I did share with you this aspect, but I want to reiterate this. The energy to achieve what you want can be facilitated by your state of health. I'm repeating this. You want to study 12 hours for an exam? If you haven't taken care of your mental health, if you don't know how to meditate for 5 minutes to calm your mind, your nervousness will make you forget your answers. If you haven't built a physical capability and a stamina, even if you want to work for the next period of time, you will get tired. So please proactively think about your own health, build that capability. You know how to eat right, you know how to exercise, you know that sleep is important, and even if you love social media and your friends, you shouldn't be up at 1 in the morning on your phones. You know these things. Begin to practice them so that you protect your health from today. Don't take it for granted. That is, I think, my next message. But let me end by saying, maybe the sky is not pink, and maybe it's any color of the rainbow that you choose. Some of you may paint it a beautiful blue. Some of you may paint it green and change the environmental lens that the world applies. Some of you may find it white and be pure and pristine. Each of you build your own passion. The sky is any color that you want it to be, and therefore go out boldly into the world with the blessings of your teachers, with the support and the love of your family, with the good wishes of society, and the great hopes and dreams of humanity. Go out there and make it happen. The sky is pink and any color you want it to. We love you all. God bless you. Thank you.